firstly, very much kind of welcome Michaela from the Suffolk Office of Data Analytics. And I think we've got an action-packed session this afternoon to talk about data sharing and how they've overcome barriers to breaking down kind of barriers to data sharing. So we recognise that data sharing across multiple organisations is a really kind of emerging practice within the public sector, and something that we all need to continue to do, as we heard from the Chief Constable this morning, talking about kind of a call to action for us to share data, but to share data for the purposes of generating insights and supporting collaboration across some of our shared challenges. We all need to ensure that we understand the associated data governance, data matching and data meshing techniques that can help us to do this, but do it in kind of robust and ethical ways. It's a real balance. It's a real balance between trying to find kind of how we identify people, how we maintain their privacy, and actually we need to kind of strike that balance in order to achieve meaningful insights that help us to overcome those barriers to share data, that inform service delivery and service design. And that can be a really super challenging thing to do. We know there are two common problems in relation to kind of building a joined up evidence base through combining data together and working across multiple partners. Those are kind of concerns around kind of information governance. And then the second one is kind of concerns around use of technology to kind of combine, store and analyse person level data. So super delighted that Michaela is joining us, who's the head of SODA, as the Suffolk Office of Data Analytics, and our neighbours and friends. And kind of Michaela is a data analytics and insights specialist with over 20 years experience working within commercial sector, the BBC, and then for the past 8 years, Suffolk's public service organisations. She believes that the analytical and intelligence functions sit at the heart of our organisation, and it can really help people to understand the scale of the challenges they face, as well as the need and the demand alongside our customers and populations. So she's going to share for the next 30 minutes how they have worked to actually overcome some of those barriers and established a system-wide information sharing framework leading to the creation of a new linked data set and service architecture.
Thank you, Nikki, and hello, everybody. I'm just going to share my screen, and it's there, is it? I'm just going to go on to presentation mode. So, perfect. Excellent. I think that's there. So, as Nikki said, so I work for the Suffolk Office of Data Analytics, or SODA for short, and we've been going for quite a few years. So I'm just going to talk a little bit about our journey and what we are before I just go into actually the meat of the presentation in terms of how we went about breaking down the barriers to information sharing or data sharing, and where we are at within SODA at the moment with a linked data set. So I think we are quite lucky in Suffolk that early on, a few years back, the system got together and they understood that they needed to work together in terms of collaboration to make the most of their diminishing resources. And one of the areas that they then felt was necessary to work from and always start from a joint evidence base. So I was brought in 2016 to kind of drive this kind of agenda around a joined up evidence base. But then we also started to obviously understand a bit more around what the systems were, what the processes are, and some of the barriers that needed to be broken down. So in 2018, the Suffolk Chief Officer Leadership Team, so an existing group of all the chief execs from all public service organisations, commissioned SODA. And we are then, since then, have been funded by all of those organisations. So all the local authorities, so we've got 4 districts, 1 borough, obviously county council, the police, and now the ICS. Originally it was 2 CCGs. And like I said, we were tasked to drive and accelerate the data and analytics agenda, especially around using our own data to build a truly local picture of Suffolk residents and communities. So on the picture there, you've got our key objective that was kind of then developed and kind of shared across all of the partners and teams so that we could get buy-in. And it is really about combining data to support decision-making, improve policy, service design, and ultimately to improve the lives of Suffolk residents. So just what Nikki was talking about at the start of the session. And when I started in 2016, it was very much about give us the story, Michaela, give us the evidence, give us the evidence. And I kept saying, I can't give you the evidence because I haven't got the wiring under the desk, I haven't got the IG, I don't have the data, I don't have the systems. And only in 2018, when we proved kind of the concept of the evidence base being, something that was what the system wanted and wanted as business as usual and was happy to fund, were we able to start really on the process or on the path of information governance and information sharing processes and systems. So I'll go through those two in a minute. That's the focus of the presentation. Just to say, we are quite a small setup. We are kind of 4.5 people. The key person that I recruited, the first one was an information governance and data security lead, and he has been absolutely vital. He was meant to be here today as well to be part of the presentation, but given the small team, we had to split kind of our resources. But we do draw on resources from other teams. So we do rely on some of the IT teams in some of our partners or some other analysts where there is capability or capacity in the system. And we also link in with the University of Essex, with the University of Suffolk, and our health and BCSE partners. So before I go and explain a little bit more about the IG side of things, the way we've made collaboration a success is really we've basically achieved buy-in from all organizations and all levels. So I know you might not be able to see everything on the slide. I know that my presentation will be shared afterwards, and the presentation actually includes an appendix where I explain a little bit more and have some more detail on some of the things I'm talking through. But also, I'm more than happy to always share any of our guidances, templates, things that we've used to set up some of the processes and ways of working of SODA. So we've got a very clear governance structure, which is on the left. So like I said, there was an existing chief officer leadership team. They are our commissioners, but we then set up the 3 other groups, if you like, the blue, orange and green ones, to kind of make SODA work. And all of these meet on a regular basis to make decisions or to discuss SODA projects. So we've got an executive group who are more at the strategic level. That's the blue one. Then the orange one is more at a management kind of operational level. And then we've got the doers, i.e. an analytics intelligence collaboration group, where we discuss how we work, what we do, learn from each other, and actually also do some upskilling as part of that. And everybody can bring a project or an idea to SODA and say, look, I've got this problem, I've got this hypothesis, I want to do something about this. Can SODA produce an analytical product that will answer these questions? And we have a very clear assessment framework that is discussed at first at the PMG, so the orange group, and then broken down and kind of taken through the executive group before it goes on to the SODA work plan, if you like. But it has to be something that is kind of working as a priority for Suffolk as a whole. So how did we go about it? So the very first thing we did was, like I said, try to remove the concerns around information sharing, because that was what held me back between 2016 and 2018 to really do and provide what the leadership team wanted. So the very first thing we did, or Daniel did, was he co-produced an information sharing assurance gateway, or ISAC. I'll explain that in a minute. And also supported the setup of an ethical data stewardship charter and an advisory panel, which is open to not just SEC, but to SODA and each individual partner as well. The key one is here that we've kind of did both a top-down and bottom-up approach. So the first thing we asked the chief executives was to sign an information sharing charter. And I've just put the vision and the commitment that they signed up to on the right there. So the vision in 2018 was we need to use data as an asset far more to transform our services for the benefit of the people in Suffolk. And its economy whilst ensuring that we only share data that is necessary and protecting the privacy of the individual. And so on the commitment side, the key bit is that collectively we will work from a default premise of the duty to share being equal to the duty to protect. So we always come off from a perspective of, this is the ideal, this is what we would like to do, can we do it? And that's where the ISAC comes in. And that's the diagram on the left-hand side. So when we start a project, and at the moment we've been working on a project-by-project basis, but that will change, and I'll come to that in a minute. The information sharing assurance gateway always starts with somebody comes in, has, like I said, a problem, a question, a hypothesis, and we have a look at whether this can be addressed using data. And we will have a look at what data have we got available. Do we have the capability, the capacity, the technology to do that project, and what methodologies might we use if we were to get the data? And only then do we bring in and start writing a DPIA, so the data processing impact assessment, because we don't want to use the information governance or kind of the kind of all of that area as the decision maker. It's an enabler for us. So we start with a funnel, we kind of hone it down a little bit, write the DPIA. The DPIA is still as wide as possible, and we will go then to the information governance leads in each of the organizations, say, in an ideal world, this is what we would need to answer this business question or this problem, or to be able to do this project. And they will then come back and say, yes, no, well, if we remove this variable, or if we just tighten this tiny bit, then we can proceed. So we have a very clear kind of process and templates and guidance notes that everybody's now been working with for a few years. So the process now is quite quick as well, because everybody kind of knows what's coming and how it's being kind of set up. So we then go through a process of the DPIA and the ISA, if you like, and then we start using the data, and then we review and have the lessons learned. And when we start using the data, so in terms of then the processes around the sharing of data, the physical sharing, we've got some a SharePoint setup that is accessible. It's a bit like a trap door. So basically only named individuals in each organization have access to it. They deposit the data, and the SODA team immediately then removes it and puts it into a safe space. And at the moment, we are hosted out of County Council. So most of the stuff, most of the data in our data warehouse at the moment sits within the Suffolk County Council environment. That used to be in the first few projects on-premise kind of a data warehouse, but is now moved into the cloud. So it sits in Azure, and that's where we have, but we've got a segregated, dedicated space for SODA within this SCC kind of setup, because obviously of the sensitivity and the multitude of data sets that come in. What we also then have the opportunity, or the kind of the is the kind of the advisory panel, the ethics advisory panel, and we've only used that once so far, but we would use it quite early on in kind of in the decision-making process. It is an advisory panel, not a decision-making panel, but it has helped in some sense, and I'll explain in a second, kind of alleviate further concerns that especially in the information governance space. So this is kind of the process and the kind of the way that we go about our information governance side of things. And I just thought it might be worthwhile just showing or showcasing some of the data we have shared, so that you understand quite at what scale as well that we're doing things. And it is sometimes quite scary, I have to say, especially, for example, the last one on the list, the Serious Violence Duty, was a lot of records. Over 300,000 records were shared. So a fairly simple project that we started out with, but which has had great success, but also pulled in, maybe the doubters, if you like, a little bit in terms of why we would want to share data. And that was the death registration and coroner inquest data sharing. It's always been available to some extent to some partners, but not all, and not all of the information. So what we were able to do, or what we are able to do and do now on a weekly basis, we don't just share the name, date of birth, full address, and cause of death of the deceased. We also share the information of the next of kin and the informant. And that is really helpful, especially to revenue and benefits teams and the housing teams. And I'll on the next slide, I'll talk a little bit about the impact and the kind of benefits that SORDA has brought to organizations using kind of these data shares. For our DA data project, we shared name, date of birth, full address, dates of incidents, and service contacts for all victims and perpetrators of DA from police, social housing, refuges, and social care. During the COVID pandemic, we were asked to set up a really quick data set to go beyond just those that might be vulnerable in terms of a clinical have a clinical vulnerability. And because of the ISAC, because of our existing processes, we were able to set up the entire IG to get 40 datasets in 1 week. And that was a real success. And that was a really good example of all of the work that we had done to get us to a point where everybody was comfortable in sharing a lot of data and a lot of information. And it included waste services, benefits, social care, NHS shielding list, GP data, all sorts, and including full name, date of birth, full address, and flags. The Suffolk Against Gang Exploitation team and criminal exploitation program evaluations worked slightly differently. Here we started out with a list of names. So all of the children and young people that were actually part of an intervention by these teams or in this space. And then we shared those names, date of birth, and full address with the police, with youth justice and education, and then got information for any interaction that these children and young people had for the past 5 years with any of these services, really to understand the pathways and whether their behavior changed following the interventions of the criminal exploitation program. And then the slightly scary one, like that I mentioned, which was for the serious violence duty. So again, name, date of birth, full address, demographic, incident-related data on all perpetrators, victims, and witnesses relating to an agreed offences list from the police. And this was then sent to other partners, notably Suffolk Probation, who are not actually a SODA partner, but we got on board as well. Youth Justice, Housing, Social Care, and they then matched those data in their databases and returned what they held on these individuals. And this means that our serious violence duty strategy, which was published obviously last month or the month before in January, was really based on local data rather than generic data or publicly available data. So it kind of, shows the kind of the range of what we're sharing. And the reason why we always share name, date of birth, and full address is actually for our matching purpose. Unlike the NHS, we don't have a unique identifier, so that's our process. Our process of matching the data sets is name, date of birth, full address, and then some others. And over time, we've developed an SQL script which gets evolved every single time we use it. And the matching gets better and better and tighter each time. So onto the SODA link data set. So out of all of those projects, especially though the SODA Vulnerable Persons Data Project and the Serious Violence Duty Project, the system has decided that they need something a bit more on a permanent basis. And really the business question at the top of it was, how can we identify, understand, and proactively work with individuals, families, communities to enable early intervention to target resources in the best way? So our approach is to create a linked data service architecture, which we have a DPIA for, which kind of is quite broad. But for each project that then sits underneath it, we have a really short ISA to just kind of say, is this still within the original purpose and kind of objectives of the project? We will start collating identifiable data from all partners on a monthly basis. The list is there and is quite wide-ranging and vast, and we have had a final success recently where it will now include DWP benefits data, which we had to fight for quite a long time. It was a lot of lobbying for 2-3 years, if not longer. All my grey hairs are from that, I believe. Again, like I said, we're using our SQL matching data script to then link the data sets and hold the data set in an Azure data warehouse. It will be held in identifiable format, and I think that's key, but for analytical purposes, we will anonymize it. So only a very small number of people will will ever have access to the actual identifiable data. And like I said, the data set can be used for pre-agreed projects and purposes. And if there was anything that might be beyond the original kind of broader sense that we've set it up for, then we have a very, very quick, short process of just checking that it's still can be part of that. So on just, kind of to finish up, because all of this is great, but like Nikki said right at the start, unless you then use the data and you're actually using it to make a difference, there is absolutely no point in it. So these are some of the things that we have been able to achieve through our kind of data matching and kind of our projects. So we've enabled the distribution of kind of over 5 million of the winter grant scheme to those that most need it, because we use the vulnerable persons data set for that. Similarly, on the bottom right hand side, that data set was also used to create or secure some funding for vulnerable people in places in East Suffolk. We, through the evaluations in the criminal exploitation and urban street gang space, we've kind of that evaluation and the data matching showed the local successes, and it secured local funding to set up criminal exploitation teams in 3 locations across Suffolk, and also the ongoing improvement of those services around criminal exploitation. We did a kind of a project around disparity in youth and on children's services across the county. And again, that showed up huge disparities within Suffolk, and a task and finish group was established to reduce those now, and they are working on that. Very, very practical kind of impact. Some of our data sharing, like I said, for example, in the death registration space, it reduced the loss of income from social housing tenancies when properties become unoccupied upon death of a tenant. But also when, kind of reducing overpayments by adult social care upon the death of a service users. And social care, for example, adult social care never used to get death registration data. That was the first setup from our side. There are a couple more on here. And I think overall, it really, the whole process and the way we got about it, and the fact that we did the co-production with everyone, means that there is improved collaboration between all of the service organisations, public service organisations across Suffolk. So I think it's been a key thing to set up. And sometimes it did hamper our projects, and maybe some of the projects weren't as quick as we wanted them to be. But now that they are set up and that the processes are accepted and have been proven, every project is going faster and faster. And that's me.
Excellent. Thank you, Michaela. Some really good kind of use case studies there. And I guess that from an Essex perspective, we're super impressed how you've got that amount of regular data flowing in terms of your linked data sets. We've had a flurry of questions come in, so we'll try to take as many as possible. I think just to start with, Harriet Pickering has kind of said, who can receive support from SODA? Any organisations in Suffolk or wider? Just before you answer that one, Michaela, we obviously do have an Essex Centre of Data Analytics, which are equivalent, which is made up of 3 partners, which is Essex County Council, Essex Police and Essex University. A bit like Michaela's story, we do have an independent data ethics committee made up of specialists to help us assess projects and think about ethical risks and concerns when we're taking on particularly advanced analytical projects where we're thinking about kind of predicting things before they happen. but we also have kind of skills and capabilities from across those three organisations that we can deploy to support partnership projects. So if you are interested in contacting us to find out more, then please do so afterwards. But yeah, I don't know if you want to answer the question about kind of who you work with in the Suffolk agenda.
Yeah, so in Suffolk, anyone can bring questions in, and that does include non-SODA partners, if you like. So like I said, we do work with the third sector as well, and they are quite often part of a lot of the collaborative kind of efforts anyway. So in the criminal exploitation space, or in the DA space, or in kind of like the community space, a lot, you know, around vulnerabilities. The councils work a lot, you know, kind of with the VCSE, so they are part of that in a sense. And actually, for some of the projects I haven't mentioned, but some of our commission services are part of that. So Anglia Care Trust, for example, who are the biggest partner in the DA space, are part of the data sharing for everything that we've done. And we are trying to work with refugees in other areas as well to see, can we get your data or not? And in some areas, sometimes it is possible. In some it isn't, because it's based on consent, or the data capture isn't as good, and the quality wouldn't be there to be able to match the data sets in. So
nice, excellent, thank you. I've got a question from Nicola, who's in SNE ICB. Why use SODA rather than Optum when we think about kind of a place to kind of share data? And she assumes there's a place for both.
there is, and we very much work very closely with the PHM teams, and so Alex Woyan and Lewis on that side, and Richard Watson. So at the moment, in Suffolk, we've always gone kind of parallel. So what I call local authority land and health land, and we find kind of doing that. And I guess SODA linked data set is the equivalent of the population health management data set, which is obviously through Optum and the Axiom data set kind of surface. So, or for example, we are now at the moment working with Lewis and the team to get health data for the serious violence duty. So that's our first kind of project. But we also have two other projects where we're kind of trying to see how we can make it work. The IG on the PHM side is slightly tougher because of the kind of, there is a you know, GPs, there are a lot of GPs, and that's the number of partners is bigger. So there is a certain way I think we have to go about this, and which usually will be SODA flowing into PHM rather than at the moment the other way around. But hopefully over time we can share data much more fluidly, if you like.
Yeah, that's excellent. And like say, kind of, I guess local authorities have been running parallel to kind of our ICSs. And like say, where ICS has been slightly more focused about the kind of health and social care agenda. Actually, there's other things, and Suffolk has a similar nature to us in terms of two-tier authority. We don't have all of the data assets. Some of our city, district, borough councils have that. And I guess kind of working along, how do you build that as an integrated data set, and actually where can the two kind of join up when both systems are ready to. So really good progress there. If you do want to hang around, we will continue to ask a couple more questions in the chat. So we'll try to get to all of them. So unknown user, but how long does the process roughly go between business questions to kind of, I guess, completion? And a slight follow-up there, which is, do you help people and partners to identify and narrow down their business questions from Lucy?
Yeah, so I think it depends a little bit. Sometimes it is much quicker because it's quite a clear question, and the need is there, and kind of the understanding that everybody kind of would benefit from a project. But also when we have already had experience with the data sets that would be needed for that. So, you know, kind of the process of having the data, the question come in to then saying, yeah, well, let's write the DPIA can be as short as 3-4 weeks. But it can also be a tiny bit longer depending on the question. And yes, we don't, while we are quite good with kind of templates and guidance in most areas, this is an area where I haven't got a template, because I think the one-to-one conversation between us analysts and the person, the stakeholder who asks the question or has the problem, is really key, because we will ask the why question until we can't get an answer anymore, and then we've got the nugget of what actually they want. So we do sit down with everybody and just, talk it through, and then phrase that, and then that goes then to as an official kind of request to the governance groups.
Yeah, excellent. There's like the 5 whys, I think, then turned into 11 whys, and
Yeah.
always start with a why. So
Yeah.
yes, that's kind of really helpful to know there. And like I say, there's that two-way relationship between the analysts learn stuff and actually your decision makers learn stuff, and together they iterate to the right problem statement. So last question then, I think, is from Natalie Mann. So kind of Chief Constable this morning, BJ Harrington, mentioned that when actually kind of data sharing involves the police, sometimes it creates concerns amongst other partners. How do you manage to overcome that?
I'm not quite sure how we've come over. We've had really good support from the police all the way to from the top and within it, and the other partners have always, because I think all partners were there from the start. Everybody kind of agreed that we will share with each other and as much, and then and hence, and we also are very clear as to when and where we need what data set. So, for example, for the vulnerable persons data, there was no police data involved because it wasn't relevant. But where it is relevant, then we make that. And that's where obviously then the DPIAs and the ISAs come in, because they are designed in such a way that everybody feels comfortable and that we're using it for the right purpose. And kind of referring back to the one of the previous questions around the opt-in side of things and the population health management side of things, that's at the moment the crunch point. Whereas PHM is, kind of we've now got kind of districts and boroughs on board and county council. Obviously, the case for police getting access to it is slightly harder. So we're going through that, but at the same time, there are kind of benefits of getting police data into the PHM data set as well, around mental health, certain areas in particular where it would be hugely beneficial to link that up. So the conversations are ongoing on that side of things. But for the projects that we have had so far, apart from the vulnerable persons data, there was never a question as to why police data wasn't relevant and wouldn't be able to kind of, would be detrimental in any which way to not match it up and find the people in the system to build the evidence base.
Excellent, brilliant, thank you. So we'll just kind of close out. So if you are thinking kind of how do I start this journey, where do I start? A session after the breaks at 1 o'clock, we do have a session hosted by Tom Aldworth with some of our district and city borough councils, just around help. Where do I start? Sharing kind of some of their problem statements and how they've kind of worked together around them. And then kind of following that, we've also got a session about being responsible and ethical with innovation from kind of Emily Moss and Rachel Newby. So if you are interested in exploring any of those areas further, then please do come along to the next sessions. And just wanted to kind of say thank you to Michaela for giving your time and sharing kind of your solar story. And we will share a copy of the slides and recording afterwards.